Good morning, Nurse Jackie. What have we got here?
Good morning, doctor. This is Mrs. G. She's an 87-year-old lady with the past medical history significant for atrial fibrillation, congestive heart failure, and well-controlled type 2 diabetes mellitus who presents to the emergency center today with 1 week history of nausea and malaise. She also notes a 10-pound weight loss in the last month. She seems to feel pretty terrible.
Okay. What are her vitals? Is she stable?
Yes, sir. Her pulse is 60 and regular. Blood pressure is 130/70 and respirations are 20. Her temperature is also normal.
Have we ordered any lab tests yet?
Yes, sir. We have a fingerstick glucose level of 120 and normal blood gases. That's all we have done so far.
All right then. Do we know what medications she takes regularly?
She takes lisinopril, digoxin, glipizide, and Lasix.
Oh, okay. Have you done a physical exam?
A brief one. Everything seems normal except her reflexes seem to be absent at her knees and ankles. I tried several times. Weird, huh?
Interesting. No neck stiffness? Muscle weakness? Motor deficits?
Not that I was able to detect.
I see. On physical exam of her lower and upper extremities, did the patient have normal pulses, sensation, and proprioception?
Yes, she had normal posterior tibial and dorsalis pedis pulses, intact sensation, and intact proprioception.
Any changes in vision? Hearing? Balance?
I don't think so. Her visual acuity was 20/20. She did not mention any other changes in hearing or balance.
And she did not mention any recent trauma?
Nope.
Okay, very good. Well, in a woman of her age with diabetes and cardiac history, there are several things to consider. It could be infectious, metabolic, iatrogenic, or very subtle symptoms suggesting something else more serious.
Do you think it's serious?
Well, she seems stable for now, so I think we have a little bit of time to work it up further.
Okay, great. Do you think this is secondary to her diabetes?
Well, it seems like her blood sugar has been relatively well controlled, so diabetic gastroparesis, while a possible cause for her nausea and weight loss, is unlikely the cause here. It's also possible that her loss of reflexes could be secondary to diabetic neuropathy. But, as I explained, it would not be very likely because of her good sugar control. Usually, in a patient with diabetic neuropathy, you would expect to see a loss of sensation in the extremities or abnormal proprioception before the patient progressed to absent reflexes.
I see. So it's likely an infection then? Maybe even an infection that has gotten into her nervous system, like meningitis. That is probably why her reflexes do not work. I am so smart.
It could indeed be an infection of some sort. However, she is a febrile and it does not sound like she has had a history of headaches or neck stiffness. I would like to look at a few more labs, but I do not know if infection is the most likely scenario in her case.
What is it, then?
If I were a betting man, I would say it's likely secondary to
A stroke. I knew it all along. It's definitely a stroke. I was going to say that first.
Her symptoms are not really typical of brain ischemia. It would be odd for an ischemic event to present purely as a reflex deficit in bilateral lower limbs and spare the upper limbs completely.
Yeah, that's totally what I meant. I knew it was not a stroke because of that. What you just said. Just trying to keep you on your toes.
Very good, Nurse Jackie. I am sure you were about to come to the conclusion that we should think about checking a digoxin level on her.
Of course. Digoxin levels. That's what I was thinking all along.
Excellent. Digoxin toxicity can present exactly like this, you see. Especially chronic toxicity. The symptoms can be very vague and hard to recognize, such as nausea, anorexia, or abdominal pain. Sometimes we also see lethargy, confusion, and weakness as well.
She did seem a little confused. I just thought it was because she's old.
Unlikely. Another important thing to be aware of in digoxin toxicity is visual disturbances. Sometimes patients can have hazy or blurred vision, see flashing lights, yellows, and green-yellow patterns.
That sounds a little bit like my Saturday night.
We should go ahead and order the digoxin level. Let's also check an EKG. There's a certain phenomenon that can show up on an EKG called the digitalis effect, which is basically a scooping of the ST segment.
Okay. Good thinking, doctor.
Let's also check a potassium level. Low levels of potassium can potentiate digoxin toxicity.
Okay, but how should we treat her? Can we give her something to reverse the toxicity?
We could, indeed. However, we need to check her blood levels first. We will certainly hold the digoxin for now. If her blood levels are high, we can consider using some dig-fab fragments.
Yay. That does sound fab. Well, I should get started on that lab work.
Okay. I do not think this is likely, but go ahead and do a thyroid panel as well to make sure this does not have anything to do with hyperthyroidism. The reason why it's unlikely hyperthyroidism is because besides her 10-pound weight loss, she does not have any of the common signs and symptoms found in hyperthyroid patients. Symptoms and signs such as heat intolerance, diarrhea, tachycardia, palpitations, or insomnia.
Okie dokie.
See you in a few.